Hey everybody, Dr. Sajewicz here. I've got a really cool case for you and I just want to get right into it. I want to explain how we kind of solved this case because this is not something that is routinely requested. So a patient had surgery on their left clavicle and they were worried that they somehow maybe damaged the subclavian artery or vein on that side. And so a patient came in for the scan, and usually that's not that big of a deal, I guess, except there's a huge metal plate going across this patient's clavicle, which is going to give you a lot of artifact. So, this was a nice discussion that I had with the technologist I was working with that day, and we were like, well, what kind of timing are we going to do here? And what we decided to do, since a typical chest CT sometimes is scanned at about 30 seconds or 35 seconds, and if you're looking maybe at the arteries in the neck or in the arm, you might be scanning a little bit later. If you're looking at the veins, you got to have time for the contrast to travel out in the arteries, go to the hand, and then come back in the venous structures. And so we kind of just picked 45 and 65 seconds. We did a dual phase scan on this patient to try to get a good study and answer a clinical question. Okay, so first, let me see if this comes up. I can drag this down. Here is that large metal plate sitting on the patient's clavicle. And as you can imagine, this is going to cause a ton of artifact. Okay, so let me bring up the CT now. And I'm going to switch my pointers here. All right, excellent. So here we're getting the left clavicle. Here's the metal plate causing all that artifact, right? So this is the early phase, right? This is the 45-second phase, and I'm going to show you some structures. This is the ascending aorta. We're getting into the anterior aspect of the aortic arch. So off of that, we're expecting to see what? The left subclavian artery. So let's follow the artery. So here comes the artery up. Now it's coming across, and it should go right behind the clavicle. There it is. I can window that a little bit differently. Right behind the clavicle, and then down into the patient's arm. Okay, great. The artery looks, fine. There's nothing pinching it. There's no pseudoaneurysm associated with it, so that's great. Well, what about the veins? Okay, so now let's take a look at the, the venous phase. So this we know is the artery. Okay, here, this is, let's say, the axillary vein, right? This is the vein in the armpit. And as it comes across, now it's becoming the subclavian vein. So the subclavian vein here, and if we play with the windows, coming across right behind the clavicle, and we window it a little bit differently to get rid of that artifact from the metal, we can see the subclavian vein not being pinched on or not injured in any way, coming across and emptying into the left brachiocephalic vein, and that's going to come across the chest and dump into the superior vena cava over here. Okay, great. So another example of how the radiologist works with the technologist. We figure out a way to do a study that isn't normally requested. How do we answer the clinical question? And we have a discussion about it. And this is what we do every day in our hospital. These things come up so frequently that we have to have these conversations. It's not just a routine, push the button, scan everybody at a certain phase all day long. We get these cases a lot where we try to have to figure something out, and we use our minds, put them together, and we come up with the best possible protocol for the patient. Okay, get together with your radiologist, form a relationship with them, and that's only going to enhance your career. It's going to make the radiologist more happy. It's going to make their career better because they're going to be able to do better reads on their cases. And you know what? It's better for the patient. Okay, this is good patient care when you can answer the clinical question that the patient actually came in for. Okay, guys, I'm working on a course. It's going to be a CT contrast course. It's going to cover everything to do with contrast and CAT scan. I'm not going to give you all the details on that right now, but I will pretty soon, maybe in the next video or two. And the other thing, if you haven't downloaded the imaging prep guide, it's free. Please go and do it. This is only going to make your job easier. It's going to give you a whole bunch of information on all the different modalities that I cover in everything from X-ray to MRI and CT. And of course, I spend a lot of time in CT because that is really the workhorse of radiology right now is CT. CT, MR, X-ray, they're all up there, but I talk about everything. So I'm giving you all sorts of great information there in the imaging prep guide. And to get it, you got to go to www imagingprepguide.com. Okay, so all one word, no hyphens or any punctuation in there. imagingprepguide.com. And thank you very much for watching, and we'll see you next time.